Hello, everyone. My name is Kim Gingras, a Senior Training Specialist here at OP, and on behalf of everyone at Office Practicum, I'd like to welcome you to today's COVID-19 Survival Checklist webinar series of Finding Revenue. Before we get started, I want to quickly go over a few housekeeping items. All attendees will be muted during the webinar. Please submit questions throughout this event by typing your questions in the questions box located in the GoToWebinar control panel. Questions will be answered throughout, and all questions and answers will be sent in a follow-up communication. During this time of uncertainty, many practices may be experiencing reduced patient schedules that will affect our revenue generation. This portion of our series will take a look at how to survive that storm and find revenue that may have been missed initially. During this webinar, we will be learning how to access and navigate the SQL library in our OP Help Center. We will take a closer look at finding revenue by using various SQLs for our OP Help Center and understanding the role of the runtime parameters in the SQL. And finally, we will interpret the caveats for the SQL library to evaluate whether a given report is appropriate for your desired outcome. I'd like to start out with a permission disclaimer that during today's webinar, we will be accessing OP's database viewer to run these SQLs. Only an administrator or a staff member with the permission of tools_DB viewer can access the database viewer. Let's get started. Activity 1, run the SQL for unbilled well visits. As patients are seen in the office for their well visits, charges may or may not have flowed from the visit notes to be converted and transmitted to payers. To ensure that well visit encounters charges have been converted and billed to the insurance, we will use the SQL for the unbilled well visits. We'll go ahead and navigate to the unbilled well notes SQL in our OP Help Center. Let's review the information that is provided to us in our SQL. The About section is a short description of the SQL. It tells you what the SQL is querying. For this SQL, it shows all well visit notes with nothing billed on the date of service range that is specified. The caveats are the gotchas and things that you should be aware of when running the SQL. For this one, a well note will show with a blank row under the codes column. If no CPT codes of any kind are billed on that date of service. As we scroll down to the code section, we will go ahead and click on the copy button. This will highlight the SQL code to where we will navigate back to OP to access the database viewer under the Tools menu, to the Database Viewer button. Once the window opens to the OP Database Viewer, we will go ahead and select the SQL tab. To run the SQL, we will go ahead and right-click in the query box and paste. To save this report, we will go ahead and enter in our parameter. And click OK. Now we could go ahead and save this query by clicking on the button for Save SQL text under a new name. Once the window pops up, we can go ahead and set in a name for our SQL. We will call this the SQL for unbilled well notes and see OK. This will save that SQL in the dropdown for future use. We can also print the SQL results if we're delegating this list to a team member or are coming back to it later. We will now take a look at the results from the query in the grid below. The grid lists the patient ID in the PATNO column, the first and last name, the date that they were seen, the well visit reason, and the codes column. We will go ahead and use the filter in the codes column and select the blank option. Our results are showing those patients that were seen on this data service for this well visit without a CPT code. We can access and navigate to the patient's account by double-clicking on the patient's PATNO. We will use Teenie Test, who was seen on 8/14/19, who does not have a well visit charge in the account. Once the charge opens, we will go ahead and navigate to the Charges tab to view if there are unposted super bill charges available for us to convert. If no unposted super bill charges are available, things we want to consider are there charges indicated in the well visit note? Are there claims that are posted in our claims note around the date of service that the patient was seen? If neither items are present in the patient accounts, request that the rendering provider capture these codes for the date of service. Once the charges are received, post the missing charges and initiate the revenue cycle. As we learn about the unbilled well visit notes SQL, we will consider these action plans. We will run the unbilled well visit SQL to identify those patients with no billed charges during the date range specified. We will also review the identified patient accounts and see if there are unposted super bill charges or missed coding for visit notes. By capturing these missed charges, you have found revenue that may have been lost. Activity 2. Run SQL for unbilled encounter notes. Similar to the previous example, there may be times where the flow for sick visit charges from the clinic and provider may be missing, therefore did not get converted. We will use the unbilled encounter note SQL to identify those patients that have missing encounter charges during a date range in order to create claims and find those revenue. We will go ahead and navigate to the unbilled encounter note SQL in the Help Center. For this SQL, it will query and results will show patients with an encounter notes with nothing billed on those date of services for a date of service range that you specify. The caveats for this is that an encounter note will show with a blank row under the codes column if no CPT codes of any kind are billed on that date of service. We will go ahead and click on the copy button to highlight and copy the SQL. We will navigate back to OP and access the database viewer under Tools, Database Viewer. Once the database viewer windows open, you will go ahead again, select the SQL tab. Now to run the SQL, we will go ahead and right-click into our query box and paste that SQL that we copied. and click on Run, allowing us to select our parameter and say OK. You can also save this report under a new SQL name by clicking on the button for the Save Query text under a new name button. We can also print if you wish to work it manually later. Let's take a closer look at the query results below. Remember, an encounter note will show with the blank row under the codes column if no CPT codes of any kind were billed on that date of service. We will use the filter funnel and filter for the blank options. Again, we also see the column for the PATNO, first name, last name, the date that they were seen, and the reason for their visit. We will go ahead and access the patient's chart by double-clicking on the PATNO. For Kaylee Test on 9/24/19, she was seen in the office, where we will take a look at the Charges tab and review if the charges are awaiting in the unposted superbills. If no unposted superbill charges are available, we will review the visit note. In here, we will review to make sure that the coding from the provider has been completed. If no coding is available, we will go ahead and message to request for the provider to provide the coding for this visit. In addition, if after reviewing the visit notes, it was identified that there were orders created, we want to verify in the task if the task was completed by our clinical team. Once charges are available, we will go ahead and post these charges. As patients are seen for their visits, we want to ensure that we bill for all patients who have had a documented encounter visit in your office during any date range. This can be verified by running the unbilled encounter note SQL to identify these patients with no billed charges during the service date range and filtering the SQL parameter for the blank codes. After identifying these patients, you will review the patient accounts and review if there were missed revenue in the unposted superbills, or missed coding from the visit notes, or tasks that weren't completed. By capturing these missed charges, you will increase your revenue. Activity 3, run SQL for unbilled vaccines. There may be times where patients are seen in the office for well visits with vaccines, or a nurse visit shots and superbill charges do not flow to the unposted superbill window. Therefore, we will run the unbilled vaccine SQL to query these patients with missed charges to ensure all revenue for vaccines are submitted to payers. Let's take a closer look. We will go ahead and navigate to the unbilled vaccine SQL in the Help Center. For this SQL, it shows vaccines that were administered but were not billed on those dates of service for a date of service range that you specify. There are several caveats that we need to be aware of when running the SQL. The first is vaccines without a matching CPT on the same date of service will be flagged as unbilled. The appropriate CPT is determined by the assignment in the vaccine setup. Also, vaccines that are still in the superbill status will show as unbilled. And vaccines that you billed but then voided will show as unbilled. Any vaccines that are documented as given on a separate date than the date of service on which they were billed will appear as unbilled. For example, Nurse Wanda, who administered an MMR on 4/14, but the billed date for the service is 4/16. It will consider this to be unbilled, as we will expect the billed data service to be the same as the day the vaccine was administered. And lastly, if you use a bidirectional registry, this report may need to be modified so that it does not show historical vaccines. This particular report does work for many bidirectional IIS, but not necessarily all of them. We will go ahead and go down to our code section and select the copy button to highlight and copy the code. We will navigate back to OP and going to Tools, Database Viewer to access our Database Viewer window. Once in the Database Viewer, we will go ahead and select the SQL tab. We will run the SQL by pasting the SQL into the query box by right-clicking and selecting Paste. We will go ahead and run and select our date parameter. And select OK. Now you can save by using the button to save the SQL to the pick list. You can also print the report if you wish to come back and work it later. Now let's review the grid. Remember that the SQL queries and the caveats that we previously reviewed for these unbilled vaccines. The grid lists the patient's ID, the first and last name of the patient, the vaccine that was administered, the administration date, and the column for the CPT code, which is blank. We will go ahead and navigate to one of our patients listed here. So this patient who was seen had an administered vaccine on 8/15/2018. We will go ahead and double click to access the patient's chart. Once we are in the patient's chart, we will go ahead and review the Claims tab to see if there were vaccines that were administered on the posted date than the date that it was administered. Note, this could be due to the vaccine task being completed on a different date than the date of service. We will also review the Charges tab for any unbilled superbill charges. If no unposted superbill charges or claims are available, we will go ahead and review the incomplete tasks and request for the tasks to be completed. Our takeaway action plan is to run the unbilled vaccine SQL and filter the SQL CPT code column to view the list of patients who have no billed vaccine charges on the date administered. Review the identified patient accounts to verify for unposted superbill charges. review the account's claims that have been billed vaccines charges on a separate date close to the date that the vaccines were documented, and also review the patient's visit note to verify vaccine CPTs billed matches what was administered. Post charges for these missing vaccines, and this will increase the revenue that may have been missing. Activity 4. Run SQL for unbilled after-hour codes. Practices may have Saturday or Sunday office hours to provide convenience to patients. During these after-hour times, we want to ensure that the CPTs, the 99050 or 99051, are coded for visits. For unbilled after hours, we verify that these codes have been captured for these missing counters. We will go ahead and navigate to our OP Help Center, to the unbilled after hours code SQL. This SQL will show all encounter notes reflecting the dates of Saturday or Sunday where neither CPTs of 99050 or 99051 was billed for a date of service range that you specified. The caveat to this would be that inpatient services of place of service 21 or 22 are not included in this SQL. We will go ahead and copy the code so that we can navigate back to OP, and we will go to Tools, Database Viewer, to our OP Database Viewer window, and select the SQL tab. Again, to run the SQL, we will right-click into the query box and select Paste. The SQL can be ran by selecting our date parameters. And select OK. You can also save the SQL by clicking on the Save SQL Query text under a New Name button, or print the report to delegate or come back later. Remember that this SQL will show those encounter notes reflecting the dates of Saturday or Sunday where neither the CPTs of 99050 or 99051 was billed for the date of service that we have indicated. We do have a couple of patients, and to access their patient's account, we will go ahead and double-click this patient who was seen on 2/11/2017 with a missing CPT code. Once you double-click, it will take you into this patient's account. You will go ahead and navigate to the charges window to review the unposted superbill charges. If charges are available, you will go ahead and post them. If a visit E&M was posted for Saturday or Sunday DOS, and you will follow your billing guidelines to either post the 99050 or the 99051 as a separate claim. Now that we have reviewed the workflows, our takeaway action plan is to run the unbilled after-hour code SQL to identify patients who were seen on Saturday or Sunday that do not have a 99050 CPT or the 99051 billed during the date range specification. You will also filter the code columns for blank code option. Review the identified patient accounts who were seen on Saturday or Sunday to post charges for missing CPTs. Post these charges, and this will increase the revenue that may have been missed. Today we learned how to navigate the OP Clip and Save library, run the various SQLs to find revenue in the database viewer, We reviewed the accounts listed in the SQL results and take the appropriate corrective actions. We also found revenue and capture missing charges. I'd like to share with you our resources for the pediatric survival checklist for COVID-19. The sequels for unbilled well visits, unbilled encounter notes, unbilled vaccines, and unbilled after-hour codes are available in our OP Help Center. As always, our mission is improving health through technology. We are committed to providing you, our practice, the best pediatric technology resources and community to drive your practice success. I want to thank you for your valuable time today during this educational experience to find the revenue and for all that you're doing for our communities. Thank you.